Greetings, Frontline. This is Val Soul, and I am here to discuss side effect management. This is a presentation that my colleague Hassan and I wrote together, and so let's do it. So when we're talking about side effects, the first thing to remember is that it's really easy to hear about these side effects and get freaked out. Kind of similar to talking about opportunistic infections, there's a confusing and sometimes scary spectrum of symptoms that someone can go through, and it can be really easy to, as a reflex, say, oh, well, I was slightly nauseated earlier this afternoon, so clearly my meds have to be switched. And so it can be really easy to freak out about this stuff. If you find yourself freaking out about this stuff, you might want to come back to this lesson or, contact me about it, because I'm interested in helping you sort through what's serious and what's freak out. So a lot of folks with HIV don't get good information about side effects, partially because, doctors want patients to be on meds, and not have the freak out factor. And it can, if you think about medical advertising, they're required to put in, both in small print and then talking really fast on advertisements, like they're required to put in all of the potential side effects. So the freak out factor is pretty high here. And so a lot of people are going not with great information, but just with what they saw on the ads. And I think that side effects actually keep a lot of people from starting meds, or the fear of side effects. So the point of this presentation is to help people sort through this, because people who know what to expect and how to deal with it are less likely to be upset by side effects or to stop taking their medications because of them, or if they haven't started taking meds, they're less likely to freak out beforehand. So if we were in person here together, I would have you list a few side effects of medication, but we're not, so we'll do that online. A few main points. One, every medication in the whole world, not just HIV meds, but every medication has potential side effects, including really innocuous ones like Tums or aspirin. And not everybody experiences those side effects, and not everyone has them the same way, but the potential's there. You should also know how to recognize side effects, and that can help you prepare to deal with them if they happen. And then we should discuss some solutions to the side effects. So if they occur, again, there's not a freak out point. One sort of difference between side effects is that some side effects are short-term or acute, and some side effects are long-term or chronic. So sometimes side effects go away on their own. Sometimes they stick around, and sometimes they show up later on, not immediately. So it's really common for folks to go through an adjustment period when they've started a new regimen. Usually that lasts about 4 to 6 weeks. If something lasts longer than that, if a side effect lasts longer than that and it really interferes with someone's life, it might be worth switching up the med. It might not, depending on what other meds they have left and what their goal is. So if someone has a rash or a fever that starts right after they begin new medication, they should always call their medical provider. The risk of what's called a hypersensitivity reaction is not across the board. Some meds are more likely to cause it than others, but anytime the sort of rash and fever particularly start right after or right alongside starting new meds, doctors want to know about that. So there are some other factors that can influence side effects. Someone's age, body weight and size, gender, overall health, CD4 count, other drugs being taken. This is not a complete list, so if there's other things that you think or know, influence side effects, let me know. One of the things on gender there, we know that women sometimes experience different and sometimes more frequent side effects than men. And it may be due to body weight or composition differences that result in higher drug levels in women. The companies that develop these meds it's difficult for them to determine if the differences that exist are influenced by body weight, or if they're influenced by other things that are harder to specify, like hormones or race, ethnicity, gender. There's also, because of the risk of pregnancy and because medications have unknown risks on any potential fetus, right? Women of childbearing age are often structurally unincluded from clinical trials. And that's changed a lot since that's one of the things actually that the AIDS movement has changed, is that women are now more included in clinical trials than they used to be, but there's still a disparity there. So it can be really hard to get answers to if the difference in side effects is due to hormones that happen in the body, if it's sheerly due to body weight and size, or if it has other things that we don't yet understand. So the sort of where the rubber meets the road question is, should you lower your dosage of a drug if you're a woman or you're a smaller size? Well, there's no guidelines showing how to lower a dose safely and effectively and making sure that you still have enough medication in the bloodstream to do what it needs to do. So if you have concerns about that, you should ask your healthcare provider. So here are some, before you start any meds, the ideal is that any medical provider is going to provide you with some options. And that you get to look at the menu and sort of choose off the menu, and that menu should include the potential side effects of any medication. And you want to be careful when two medications have the same potential side effects, because sometimes they can stack up. So the next couple slides have just questions to ask yourself. What side effects do I have the hardest time dealing with? Some people prefer nausea to diarrhea, and so they can deal with that, whereas diarrhea really drives them crazy and they can't deal with it. So there's a level of kind of self-awareness that needs to go into preparing for a medication. Can I take, or am I willing to take, other meds or complementary therapies to help control side effects? Do I have family and friends, a network of supporters that I can call on if my side effects are bad? How long am I willing to put up with a particular side effect? We also have questions to ask your provider. What are the possible side effects? When will they start? How long will they last? Will they go away by themselves? Are there long-term side effects that I won't see, or that accidentally disappear and then reappear? Can I do anything to prevent certain side effects from happening? What should I do if I have a certain side effect? Are there dangerous or life-threatening side effects that I should know about, and what do you want me to do if they happen? So this is a good point to say not all symptoms or physical problems that someone might ever have are related to the meds. Some physical problems, are due to anxiety, depression, or stress. And it's really can be counterproductive to compare one person living with HIV to someone else living with HIV. I mean, we want to share information, but one person's experience is not going to be another person's experience, and people experience side effects really differently. And the list that every medication comes with of potential side effects doesn't mean that all of them are going to happen, and it doesn't mean that all of them are going to happen for the same people equally as compared to other folks. So don't jump to conclusions based on anybody else's experience. That is a good stopping point. We're going to pick up with recognizing side effects when we come back.